we want to talk a little bit about the history of the women and the women's organizations on the wall in the Women in Pharmacy room at APHA. So let's begin and talk about Elizabeth Gooking Greenleaf, born in 1681 and died in 1762. She is the first woman pharmacist in America. She owned an apothecary shop in Boston in 1727. She was one of only 32 apothecaries in that area during that time frame. She was a mother and, of course, a wife and a very successful pharmacist. Elizabeth Marshall was born in 1768 and died in 1821. She is considered the second woman pharmacist in the United States. Actually, of course, back then we were the colonies. In 1804, she took over the management of her father's Marshall Apothecary in Philadelphia, and she managed it for a number of years and made it a very successful pharmacy. Mary Corina Putman Jacoby was born in 1842 and died in 1906. She is the first woman to graduate from a college of pharmacy, which she did in 1863 in New York City. In 1864, she became a physician and was very successful in that and was one of the pioneers of the specialty known as pediatrics. You know, she never really wanted to be a pharmacist, but she used pharmacy as a way to get where she wanted to go. Mary Olds Minor was a pharmacist in the late 1800s in Kansas. She became very active in pharmacy organizations as well as having her own community pharmacy with her husband. And in 1895, she was elected to be the first woman officer at APHA when she became a vice president. Zeta Mary Cooper was born in 1875 and she died in 1961. She was a graduate of pharmacy at the University of Iowa and served on the faculty there from the time she graduated until she retired in 1942. She was one of the founders of the women's section of APHA. She was certainly an educator, and she is the founder of Kappa Epsilon fraternity and the Rho Chi Society. She mentored so many. And if she asked a man to do something, he said, "Yes, ma'am." Anna Gertrude Bagley was a graduate from Ohio in pharmacy. She became very involved in the women's section and so on, pushing for women in pharmacy. And she became the first woman pharmacist to serve on the APHA staff. She was assisting the editor of the Journal of the American Pharmaceutical Association in the 1920s. Margaret Cornelius Dow, also known as Cora, was born in 1868 and died in 1915. While she was in Cincinnati, and while she was still in pharmacy school, she took over the management of her father's drugstore. By 1915, Cora had a chain of 11 pharmacies, a warehouse, and an ice cream factory in the Cincinnati area. So she had more stores at that point than Charles Walgreen. She died, unfortunately, in 1915. Nellie Wakeman was born in 1883, and she died in 1952. She is the first woman to receive a Doctor of Philosophy degree in pharmacy, which she did in 1913. She was a faculty member at the University of Wisconsin from 1913 until she retired in 1946. She was very, very interested and wanted women to go on for advanced degrees. And because of her, the University of Wisconsin at one point had a large number of women PhD students. She also is named as the Nellie Wakeman Fellowship, which is given every year from Kappa Epsilon fraternity for a member pursuing graduate study. B. Olive Cole was born in 1883, and she died in 1971. She was very active beginning in the 1920s in organizations. She became a faculty member at the University of Maryland, where she served until 1953. She was a wonderful mentor and role model for women in pharmacy. Edna E. Comperna Gleason was born in 1886, and she died in 1963. She was very active early on in California pharmacy. She had her own drugstore and so on. And in that pharmacy, she promoted patient-oriented practices, which was really rather unusual if you look at the era in which she was doing this. She also became a leader nationally in the fight for fair trade pricing, which she won. Sister Mary John Gierleman was born in 1889 and died in 1975. She was an Army nurse during World War I and then became a pharmacist and joined the order as a Sister of Mercy. She was very, very prominent in the practice of hospital pharmacy and was a charter member of ASHP and later served as their treasurer. She was a very prolific writer and lecturer, and when she passed away, she had a military funeral. Sister Mary Gonzalez Duffy was born in 1909 and died in 1985. She also was a Sister of Mercy and became very, very involved in hospital pharmacy, specifically at the Mercy Hospital in Pittsburgh. She again was a mentor, role model, moved so many things to happen in hospital pharmacy. And in 1978, she became the first woman and the first religious sister to serve as president of the American Society of Hospital Pharmacists. Gloria Niemeyer Franke was born in 1922 and died in 2008. She was very, very, very involved in pharmacy organizations and was a staff member both at APHA and ASHP during those early years, especially of ASHP. With her husband, Don Franke, they became the major couple in hospital pharmacy, not only in the United States, but throughout the world. And I think she was a wonderful mentor. She mentored anybody that she could find. She was the first woman to receive the Remington Honor Medal, which she did in 1987. She is often referred to as the First Lady of Pharmacy. Catherine Keating, also known as Kay, was born in 1922 and she died in 2009. During World War II, Kay was a wave radio operator. After the war ended, she went to pharmacy school and re-entered the Navy into the medical corps. Two interesting facts about her is she is the only woman in the Navy who started out as a seaman recruit and ended up as a full captain. And that's what she was when she retired from the medical corps, the Navy Medical Corps. She also, again, was another wonderful mentor and role model, both for males and females. Mary Louise Teague Anderson was a practicing pharmacist in Delaware. She became very active in pharmacy organizations, specifically APHA nationally, and was the second person to serve as an APHA vice president in 1967. But in 1968, she was the first woman to serve as Speaker of the APHA House of Delegates. She was very, very involved in all aspects of reimbursement and so on for pharmacy. She also did receive the Remington Medal later, and she has passed away. Joy Holloman Donaldson was a leader in Alaska pharmacy for a number of years with so many innovative practices. She is well known among women pharmacists because she established the Good Old Girls dinners at APHA annual meetings to help women pharmacists get together. We are very, very fortunate because Joy is still with us. Mary Munson Runge is another example of someone who has done so much for pharmacy and for patients. She was very active for many, many years in California pharmacy in terms of organizations. She was a community pharmacist at the time, and she did become very active in APHA. She became the first woman, the first African American, and the first community pharmacist to be president of APHA in 1979. Unfortunately, Mary is no longer with us. The women's section of APHA came into being in 1912 and basically lasted until about 1923. This group was founded by 6 women pharmacists and 6 wives of pharmacists in order to have a place to meet and talk. And this group from the very beginning was so supportive of women in the pharmacy profession and worked so hard, including the fact that they were very involved in the founding of Kappa Epsilon fraternity. Lambda Kappa Sigma fraternity was founded in 1913 at Mass College of Pharmacy to unite women pharmacy students and later pharmacists. They have been a prime mover over all of these years, promoting women in pharmacy and being supportive of their members. Kappa Epsilon fraternity was founded in 1921, again for women pharmacy students and pharmacists, and again has continued to be very supportive of their members and women in pharmacy and APHA and other organizations. Of course, Kappa Epsilon, as have all pharmacy fraternities, are now co-ed, but they still have a wonderful presence on promoting women in pharmacy.